Did you know there's a type of diabetes that's caused by other medical conditions? Welcome to the complex world of secondary diabetes, also known as diabetes mellitus type 3. This form of diabetes doesn't occur in isolation. It's triggered by other medical conditions or factors that hamper insulin production or escalate insulin resistance. Picture this. Your body is like a finely tuned orchestra, and insulin is the conductor. When everything goes smoothly, the music is harmonious, but introduce a disruptive element, like a pancreatic disease, a hormonal disorder, or even certain medications, and suddenly the music is off-key. This disruption is essentially what happens in secondary diabetes. The disturbance caused by these conditions hampers the normal function of insulin, the maestro of our body's glucose management, and the result, a rise in blood sugar levels. So, secondary diabetes develops when these conditions interfere with the normal functioning of insulin in the body, resulting in elevated blood sugar levels. But how can you tell if someone has secondary diabetes? What are the symptoms? Well, the symptoms of secondary diabetes often mirror those seen in other types of diabetes. These can include an increased thirst and frequent urination as the body tries to rid itself of excess sugar. Fatigue is also common as the cells are unable to use sugar for energy. Blurred vision may occur if high blood sugar levels cause fluid to shift into the lens of the eye. You might also notice slow wound healing as high blood sugar impairs the body's natural healing process. And lastly, unexplained weight loss can arise as the body starts burning fat and muscle for energy. However, secondary diabetes is unique in that the underlying medical condition causing it may present additional specific symptoms. For instance, if it's caused by a pancreatic disease, there might be abdominal pain or jaundice. If a hormonal disorder is the culprit, symptoms like weight gain, muscle weakness, or skin changes might be present. So while the symptoms of secondary diabetes are similar to those of other forms of diabetes, the underlying medical condition may also present with additional specific symptoms. Now that we know what secondary diabetes is and its symptoms, how can it be managed homeopathically? The beauty of homeopathy lies in its approach to treatment. Rather than focusing solely on the disease, homeopathy zeroes in on the individual suffering from the disease. When it comes to secondary diabetes, homeopathy seeks to address the underlying cause of the condition and manage symptoms, all while promoting overall health and well-being. So, how does this work in practice? Let's delve into some commonly used homeopathic remedies for secondary diabetes management. First up is phosphoric acid. This remedy is often indicated for symptoms of fatigue, weakness, and mental exhaustion that are frequently seen in diabetes. It may also address symptoms of neuropathy and vision problems. Next, we have Syzygium jambolanum. This remedy is useful for managing symptoms like excessive thirst, frequent urination, and weakness. It could also help regulate blood sugar levels. Uranium nitricum is another remedy to consider. It's recommended for diabetes with symptoms like excessive thirst, loss of appetite, and weight loss. Additionally, it may support kidney function and reduce sugar levels in the urine. Then there's lycopodium. This remedy is useful for addressing digestive disturbances, bloating, and flatulence, often seen in diabetes. It could also help manage anxiety and sugar cravings. Finally, we have arsenicum album, which is indicated for symptoms of restlessness, anxiety, and weakness, often associated with diabetes. It may also address symptoms of neuropathy and digestive disturbances. Remember, each person's journey with secondary diabetes is unique. Therefore, it's crucial to consult with a qualified homeopathic practitioner for personalized treatment. These remedies can be used alongside conventional treatment to support overall health and well-being for individuals with secondary diabetes. And let's not forget the importance of regular monitoring of blood sugar levels and maintaining open lines of communication with healthcare providers. These are essential for effective diabetes management. Remember, it's important to consult with a qualified homeopathic practitioner for personalized treatment. Homeopathy can be used alongside conventional treatment to support overall health and well-being for individuals with secondary diabetes. Regular monitoring of blood sugar levels and close communication with healthcare providers are essential for effective diabetes management.